Hello everybody, this is Dr. Nadeem and we are with Neelam Path Lectures, the Pursue series. As you are aware, all our lectures are available on YouTube. We also have a Telegram group. You can join this group. This is very useful for accessing all lecture related information. We also have a Google Drive where the PDF of all lectures are available and a master integration key by which you can navigate between the PDF and the YouTube. These are the disclaimers. We are with phase 3, which is recorded pathology lecture. And today this is Pursue's 5 view, which is general pathology, and we are streaming live from Kolkata. We have got a very interesting topic and a very knowledgeable person to speak on that. The topic of the day is pattern recognition in histopathology, something which is very much required for everybody practicing histopathology. And to speak on that, we have Dr. Bhaskar Mitra, who's an MBBS from Calcutta, and MD, DNB in pathology, a gold medalist. He's a consultant histopathologist, like the famous Tribedi Diagnostic Laboratory, Kolkata, with multiple publications in national and international journals. He's also a reviewer of various journals like the International Journal for Surgical Case Reports, British Journal of Medicine and Medical Research, Journal of Cancer and Tumor International, Journal of Surgical Technique Development, Journal of Applied Life Science International, International Journal of Dermatology. With this, I would request Dr. Bhaskar Mitra to start his lecture on pattern recognition in histopathology, something which is very basic, but very important to understand histopathology and to understand how various patterns of histopathology occur in various slides which we see. Over to you, Dr. Bhaskar. Thank you so much.
Good morning, everybody. First, I want to discuss the story of every residents of pathology or any medical residents. We always find some mistakes what we have done in the first year of MBBS. Now, when we are entering into the MD course, we feel same problem what we faced at the first year of MBBS. Now we are at the crypt of histopathology. Now there are so many colorful things, so many beautiful instruments, so many beautiful things what we can see under the microscope. But it always astronizes us, but at the same time it is very difficult for a newcomer to understand how will we make the diagnosis, how will we apply the knowledge of histopathology on the slides. So there we can see different frustration among all the residents. We all know that whenever we come out with the name lymphosarcoma of the intestine, I can assure 99% of the student will tell about the movie Anand, but nobody will tell that lymphosarcoma of the intestine is actually non-Hodgkin lymphoma of the intestine. Now, this is the dilemma. So, my presentation aims to recognize the different basic histology pattern for the first year residents so that they will start understanding the histopathology patterns in the slides while seeing them. So, this is a pattern recognition class in pathology. So these are the beautiful architecture what we see under the microscope. There are different beautiful things. Some are looks like a pillar, some beautiful designs with the different color variation on each of them. After this class, every I think everybody now can differentiate different patterns in the different disease processes, and it makes the histopathology more enjoyable to each and every first year residents. Starting with this, what we see, it's a structure made of different columns, or what we can see, a pattern of network. In a building there are some beams or some columns that are making a typical structure. Actually this is a framework or meshwork that holds the whole structure. This is nothing nothing but the trabecular pattern of structures. In the bones, there are bony trabeculae which makes this bone structure. These are the different bony trabeculae what we can see in the picture, and these are the different bony structures we can see. So trabeculae are nothing but the small supporting beams or bars. Any of the supporting strands of connective tissue projecting into an organ and constituting part of the framework of that organ. There are many fine spicules forming the network of the cancellous bone. Now, these trabeculae are the cord-like array of cells arranged and separated by fibrous septa. Sometimes this may be 2-cell layer thick, then we call it microtrabecular, or sometimes it is 8 to 10 cell layer thick, then we call it macrotrabecular. But always remember, the cells are arranged perpendicular to the long axis of this trabeculae. Here we can see the trabecular pattern in the hepatocellular carcinoma. The neoplastic hepatocytes are arranged in a cord-like pattern. Here again the neoplastic cells are arranged in a cord-like pattern. Look at this. This is the orientation of the cord. Now look at the orientation of the nucleus of the individual cells. So it's perpendicular to the long axis of the cord. This is called trabecular pattern. Whenever we see such cells standing in a line, we call it trabecular pattern of arrangement. Next comes syncytial. How the word syncytial means? Syncytial means it's a unit. There is no difference between the two separate things. Here same thing happens. There is a cytoplasmic continuity between the adjacent constituent cells. So it looks like a collection of nuclei without recognizable border. It's like not the two cells, it is the multiple cells arranged in a syncytial pattern. Here we can see like a collections of the nucleus with a syncytium of cytoplasm. No separate cytoplasmic cell border could be appreciated. So the this is the syncytial pattern of arrangement. Here in the medullary thyroid carcinoma, we can see the syncytial pattern of arrangement. Here we can see the sheets of cells, only the nucleus can be seen, individual cytoplasmic border won't be seen. It is in the case of meningioma, there we also can see the syncytial pattern of arrangement. Now comes the alveolar pattern. Where we see the alveolus? We see the alveolus in our lung. Where the lung, this is the alveolar unit, there is alveolar duct and there is a alveolar sac and there are some alveolar pores. So these are the air-filled alveolar sacs. When these cells are arranged in such a large dilated glandular pattern, this is like an alveolar, and it all drains into a duct. It may be secretion, here it is air, but it may be secretion. So alveolus is nothing but a small cavity or pit. It's like alveolus in our oral cavity, it's a socket of the jaw for a tooth. It's again a small cavity or a pit. It's a small air containing compartment which drains into the different layers of the lungs, or there may be acinus of the compound glands. We are coming to the details of the compound gland later of this discussion. There may be honeycomb arrangement of this alveolus. So the tumor cells grow in nest and clusters separated by fibrous cilia, and a little sac or nest or nested structure can be seen. This is the classical example in alveolar soft part sarcoma. Here we can see there is a small nest and sac-like appearance where there are lining cells, and in between there is a gap, and this is the classical known as alveolar rhabdomyosarcoma, where there is a fibrous tissue forming an alveolus-like structure where all the neoplastic cells are hanging onto this alveolus septus-like structures. This is the classical picture of alveolar arrangement of the neoplastic. Now we all know and very commonly known, this is the herringbone pattern. This is the herring is the ship and this is the herringbone. So what is herring? It is the name given to the type of fish found in the shallow waters of North Pacific and North Atlantic. So this is the herringbone arrangement, name given to the skeletal of this herring fish. Here we can see the arrangement. Look at the previous slides. There is an arrangement of the cells in a columns in the short parallel lines, with all lines of one column sloping one way and the line of the adjacent columns are sloping to the other way. It is a characteristic pattern. When we see, we call it herringbone pattern. So bundles are intersecting in a zigzag. Here it is in the fibrosarcoma. The one side there is a sloping of the cells in the one way, another that is in the other way. Here we can see classically in fibroma, the fibrous tumors, where we can see the classical pattern of herringbone pattern. Now this is what we call storiform, or cartwheel type appearance. Storiform means there is a irregularly hold pattern. It's like rotating something. Pattern somewhat like that of a straw mat. Having a cartwheel appearance with the spindle cells having a elongated nucleus is like a radiating from the center. It's like a cartwheel. This is the cartwheel appearance. Here the cells are arranged to the radiating way. This is the arrangement of the story. This is the classical of a MFH showing the storiform pattern. The cells are all radiating from a central area. This is the classically seen in MFH. Now what we can see in this picture, small round bundles of things. Together they are tied with another big bundle. It's like a bundle of ropes, like small threads that are tied with a bundle, making a bundle, and small bundles are again tied with together and making a large bundle. This is nothing but the fascicular arrangement. It looks like fascicles, and these are the different short cords of this whole cord. So this is the fascicular arrangement, what we exactly seen in the muscle bundles. These are the bundles of muscles arranged in fascicle surrounded by the perimycia. So fascicles, now we commonly all know the term WHO fascicles. What we mean by those fascicles, why WHO is called fascicles? This is a section or set of books being published in installment as a separate pamphlets or volume. That's why they are called fascicles. In other books, there is no fascicles. Only WHO publishes that way. That's why these are called WHO fascicles. So here is a small bundles and tight cluster of cells that are close clusters of like a flowers or leaves, and the small bundles of nerves and muscle fiber tied together forming the fascicular arrangement. There is a bundles of elongated spindly cells streaming in a polarized way from one side to another side. Here we can see classically in leiomyomas where the bundles of smooth muscle cells are arranged in fascicles. Okay, here we can see polarized arrangement of the cells from one side to other side. Now comes a difficult question to every first year resident. What is acinus and what is follicle? In my first year, I always hedge what is acinus and what is follicles. Why in prostate we say acinus, in the breast we say acinus, in thyroid we say follicles. So remember, first thing, acinus is a secretory unit. Okay, and it is an exocrine gland, so it delivers its secretion to a duct. So this is the acinus of a salivary gland or breast gland where the ducts are secreting and these contents are drained into a gland. So acinus always contains a duct. So in breast there is a acinus, in the salivary gland there is a acinus, in prostate there is a acinus. Its are clusters of cells are lobed like a berry, such as raspberry. Acinus is the Latin term of berry. So it's berry-shaped termination of the exocrine glands. At the ends, there is a berry-shaped lobulated arrangement. In follicles, we won't get any duct. They are the small spherical group of cells containing only a cavity. This is true only for the endocrine glands. So in thyroid, we call it follicles. Okay. Also remember there are other follicles in our body like dental follicles, hair follicles, lymphoid follicles, ovarian follicles, and we above all there is a thyroid follicles. So the follicles don't got the ducts, acinus got the ducts. Now alveolar pattern and acinus both are same exocrine type of glands, but acinus, the duct is a smaller, slender type. In the alveolar ducts, it's a thicker and a larger trunk. Now coming to the ducts. As per the ducts, we divide different glands in a different way. If the glands are straightforward, there is a secretory unit followed by a draining unit over there, and it is not bunch elongated things. We call this as a simple acinar or alveolar gland. If it's branched and it is a straightforward branching with the individual branch containing its own acinus, then again is a simple branched gland. But if the gland is elongated one, it's a tubular. If it's like a coiled one, it's a simple coiled tubular gland or maybe simple branched glands. Here there is a elongated gland with each and everything has got a separate acinus for each elongation. When it becomes compound, there is a branching in the duct system. So each and everything doesn't contain the same 1:1 acinus. They have got multiple acinus branched at the end. So this is compound. So this is a compound alveolar. This may be compound tubular alveolar. This may be compound tubular. Here we can see the branching hierarchical in this glands. Now, after this is the glandular arrangement. Glandular arrangement, so always there is a basement membrane. On the glands are all lining cells are standing on that basement membrane with the orientation of the. So glandular patterns, they are forming glands-like structure with the lumens having polarized cells radiating around. This is the glands, typical glandular adenocarcinoma structure. The glands containing secretions with a basement membrane having the cells lined with neoplastic cells. Now what we see, this is nothing but the sheaths. Okay, of different pore sizes. It may be large pore size, small pore size, very small mesh of cells. Cribriform is like sieve-like containing many perforation. Describing a structure of many perforation or punctures, we termed it cribriform plates. Like the ethmoid bone has got a cribriform plate with multiple perforation. Same type of punctuated things or gland-like spaces in a sheets of epithelial cells. When we see, we term this cribriform. This is a perforated pattern, well-formed holes within the glandular lumen. Here we can see the punch-out cystic areas within the sheets or islands of epithelial nest. Breast DCIS showing cubiform appearance, again the punched out hole-like areas. Here the basement membrane is not within this. So this is not a closed glandular pattern. This is a typical cribriform pattern. We have to understand very closely cribriform and glands. Now what are these? These are the long elongated tubes. they are lying parallelly with each other. So these are that when we see any structure looking like this elongated tubes, we call it tubular structure, and we call that tubular arrangement. These are the minor tubes, especially the anatomical structure, crowded small line tubules lined by single or multiple layers of cuboidal to columnar epithelium. This is tubular adenoma, where we can see elongated long tubular glands. This is tubular carcinoma. Here again the elongated long tubular distorted glands seen in the tubular carcinoma of breast. Here the elongated single line cellular tubules are the important structures. Now what we see, a small crypt with a small papillary like area going here in here, here in there appearance. This is a small scordy of the heart showing small appearance. This is nothing but the small nipple like processes or projections. One certain small protuberances of papillae what we see in the tongues. They are the small vascular pores of the roots of the hair, papules and pimples. These are the papillary architecture. This papillary architecture may be complex branching, that is a one branch standing another branch. It may be randomly oriented, and always remember there is a central fibrovascular core within a single papillae. This is the papillary arrangement. Here we can see the elongated papillae. It's a lollipop-like with a core showing the typical fibrovascular core containing the blood vessels. This is again papillary thyroid carcinoma showing the typical papillary arrangement. It's a like a lollipop. It's a small stalk fibrovascular core with a surface lobulated. We all know these ancient figures, and we have many similarity in the medical science. This is nothing but the Medusa head, and this is the head of Medusa. Here we can see small elongated snakes coming out through the head. All snakes has the base attached to the Medusa's head. So it's a Medusa head appearance, what we call the micropapilla. Next, this is the micropapillary architecture. Here you see the previous one, each and every papillae has got a fibrovascular core, but there is no fibrovascular core. These are the elongated and look very carefully. Each and every micropapillae stands on the single basement membrane. This one is standing here. This one is again standing here. This one is again standing here. So this is the true papillae having a papillary arrangement with a fibrovascular core, but here this is the small micropapillae, no fibrovascular core. If we cut here, we can see the inside there is a fibrovascular core, but if we cut here, no fibrovascular core can be seen. We can see only the cells. Here the fibrovascular core can be seen in a cross section, but no cores here. All the micropapillae stands on the base of this papillary arrangement. So this is the difference between a micropapillary and true papillary. It is a very important in cases of ovarian tumor to differentiate. Again another interesting picture of Red Indians. They are Red Indian army lying in a standing in a rows and marching forwards. This is the classically we call this Indian file appearance. Remember, very nothing personal. This is not meant for the India, not Indian army. It's a Red Indian army standing and one after another, and all are walking in a single person profile. So here again the tumor cells are also arranged in a single lines, one after another, one after another. Here, classically seen in the lobular carcinoma, look at the cells arrangement one after another, one after another. It's like a single cell arrangement. It is always single cell arrangement. That is the difference with the trabeculae. Trabeculae usually have more cells in the arrangements. And this is the classical same pattern what we see in the Indian file appearance seen in lobular. This This is again the Indian file appearance, long elongated things. Now, what is this? These are all the nails with a long big head. This we call hobnails. So when we resemble this large-headed nail used particularly for the shoes, epithelial and endothelial cells with a round-up nucleus on one side protruding into the lumen like a little bumps, then we call it hobnail arrangement. Here we can see the nucleus part is bulging into the lumen. It is a hobnail arrangement of the cells. Here we can see all the nucleus are like a bulging inside the lumen like a small protrusion. The beautiful roses, red rose, blue rose. Here we see the petals. Just see the petals. The arrangement of the petals. It's in the central area. It is surrounded by these petals are arranged. So when the arrangement is like an ornamental way, like a floral design, it is situated like a decorative motif. Sometimes they close some of the trees with the leaves are around surrounding like a crowded circus. See this picture. This is a batch showing typical petals-like appearance. Here we all see this type of plants in our houses where the leaves are arranged around a central area. These are the different Gothic windows in the different church and mesquitas where we can see the cells are all arranged like a single center. All the things arranged in a concentric layer basing around this single central thing. This is called rosetoid pattern. It is more like a rosette with a halo or spoke wheel appearance. The center part may contain something like cytoplasmic processor or it may not contain anything. So this is the rosetoid arrangements. Typically center may contain or may not contain particularly seen. This is the small round cell tumor showing a typical true and false rosette-like appearance. Here again there are small cystic spaces. If we see on the meshwork there are small cystic spaces. This is called microcystic pattern. There is a loose network of cystic spaces lined by flattened cells and forming a net-like array. This is called microcystic or honeycomb appearance. Characteristically seen in the neuroendocrine tumors, carcinoids, York sac tumor very known for these typical microcystic arrangements of the cell. Now again comes the follicles. Here again no ducts, only cells are arranged in nest in a typical arrangement. What we see in the lymph nodes as a follicles. These are small body cavity or sacs or tip minute cul-de-sacs. They are from spherical masses of cell may be contained cavities or may not contain cavities. This is the arrangement of the follicles. So this is the follicular neoplasm of thyroid where we just see the follicles arranged closely packed follicles, but the no ducts can be identified in this follicular pattern. This is a horn of a deer named antler. So this is antler horn. Okay. So this is the arrangement of the, look at the capillaries, it like an horn, it is appearance. So this is the stag horn appearance, typically seen in case of hemangiopericytoma. It's like a horn of a deer, it's branching arrangement of this capillaries seen among this spindle cell neoplastic cells. Again, very common in the nights, very well moonlit night, we can see all the stars are glazing into the sky. This is nothing but the sheets of cells. This is very beautifully seen in cases of the sky, but in cases of pathology, if you see this sky-like appearance, this is called starry sky appearance. Here individual cells are apoptotic with the presence of different macrophages engulfing this. So this tumor is highly dividing and very aggressive tumor, classically seen in the Burkitt's lymphoma, where this starry sky appearance denotes aggressive and high mitotic activity among this. This is the sari side. This looks beautiful, but the previous histologic picture is very scary. This is again the beautiful picture of starry sky appearance. So now at the end we can see what is trabeculae, what is follicle, what is acinus, what is the difference between acinus and the follicle. When we see rosetoid appearance, when we call it papillary or micropapillary arrangements, all can be seen as per the patterns. Hope I have very lucidly make you understand the different pattern. This video is mainly for the first year residents to understand the different histological patterns in histopathology of different tumors. This is very nice, very interesting unless you can recognize them. If you recognize them, you will find interest. Otherwise, it is very difficult to diagnose these cases. Again, there is a task for all the persons who are watching this video. You have to separate. There is a pattern here also where the thank you is written in different languages in different patterns. So you have to know which are the different languages the thank you is written. Hope I made this video very easy and to understand the different pathological patterns. Okay, thank you everybody for listening this video carefully. Thank you everybody.